HMIS is the Homeless Management Information System. It's a local information technology system used to collect client level data and data on the provision of housing and services to individuals and families at risk of and experiencing homelessness. Each continuum of care is responsible for selecting an HMIS software solution that complies with HUD's data collection management and reporting standards. The U.S. Department of Housing and Urban Development, HUD, and the federal partners, along with other planners and policymakers, use aggregate homeless management information system data to better inform homeless policy and decision making at the federal, state, and local levels. The HERTH Act, enacted into law on May 20th, 2009, requires that all communities have an HMIS with the capacity to collect unduplicated counts of individuals and families experiencing homelessness. Through their HMIS, a community should be able to collect information from projects serving individuals and families experiencing homelessness to use as part of their needs analysis and establish funding priorities. The Act also codifies into law certain data collection requirements integral to HMIS. With the enactment of the HERTH Act, HMIS participation became a statutory requirement for recipients and subrecipients of the Continuum of Care program and Emergency Solution Grant funds. The privacy and security standards for HMIS, as described in the Data and Technical Standards Notice, seeks to protect the confidentiality of personal information while allowing for reasonable, responsible, and limited use and disclosures of data. These privacy and security standards are based on principles of fair information practices and on security standards recognized by the information privacy and technology communities. The standards were developed after careful review of the Health Insurance Portability and Accountability Act, HIPAA standards, for securing and protecting patient information. Communities are expected to continue to use the notice to implement their HMIS. In Brevard County, Florida, the Brevard County Housing and Human Services served as the Continuum of Care lead until 2016, when the Brevard Homeless Coalition became the lead agency as a separate nonprofit organization. United Way of Brevard staffed the COC from 2011 to 2016. The Brevard Homeless Coalition currently acts as the COC lead agency responsible for preparing and submitting the COC application in response to HUD's annual program notice of funding availability for homeless assistance resources and for fulfilling other HUD COC lead agency requirements. 211 Brevard has served as the lead agency for HMIS since it was implemented in Brevard County in 2001. 211 Brevard is a private nonprofit organization that manages telephone helplines and a database of community health and human services. After the Brevard Homeless Coalition became the COC lead agency in 2016, they also then became the lead agency for HMIS and manage HMIS operations in accordance with HUD and BHC standards. The Brevard Homeless Coalition approves the HMIS policies and procedures, monitors HMIS compliance with HUD HMIS standards, rules, and regulations, and develop processes for selecting new HMIS lead if necessary due to non-compliance. Monitors participation in agency compliance with HUD standards for data quality and timeliness, assesses the performance of HMIS software, and if necessary assists in selecting a new vendor, works to inform elected officials, government agencies, the nonprofit community, and the public about the role and importance of HMIS and HMIS data, support performing HUD-mandated activities including the Annual Homeless Assessment Report, otherwise called the AHAR, and Annual Point-in-Time Count Survey, Housing Inventory Count, and HMIS data quality and data timeliness reports, participate in HMIS meetings and committees, ensure that the HMIS project application to HUD is completed in concordance with the timetable for timely submission of the COC application, provide training and technical support to participating agencies in accordance with HUD standards, comply with all HUD HMIS standards and applicable laws related to data quality, privacy, and security, submit all HUD-mandated reports on time, assist participating agencies with customized data collection and reporting needs within reason and within constraints of budget and HUD-mandated responsibilities, Provide reports requested by the Brevard Homeless Coalition to aid in monitoring COC goals and activities. Serve as the HMIS liaison with HUD and the HMIS software vendor. So why do we need to use HMIS? The data is used in the community. It redesigns perceptions and values and changes expectations and aspirations. It leads the process of developing a community's ability to reach beyond itself. Today we have a collaborative data relationship with foundations providing grants to service providers targeting hunger and homeless prevention. Types of foundations include private, corporate, community, and recruiting funding sources beyond your geographic area. Many grant providers now require HMIS input and tracking. Community-based collaborative data can bring more dollars into your community, enable community-wide initiatives, 10-year plans, educational awareness, grant opportunities, and build partnerships, including faith-based. Collective data shows the greater need for larger funding sources, RFID systems, expansion of HMIS licenses, computer systems for agencies without tech budgets, and HMIS can be used as a match for grant opportunities. HMIS can bring together all types of human service agencies, including partnerships with faith-based partners. Easing the faith-based volunteers into technology through HMIS gains allies. You can bring technologies they don't have. You offer connectivity to the rest of the community. A mission of HMIS should be to reach out into the community to offer solutions, advance the community's technology efforts, build partnerships that currently do not exist, look for common ground for funding streams outside of COC, and provide resources or data to the community for development of a 10-year plan, public awareness, and partner agency growth. The Continuum of Care Program HMIS Manual is intended to support data collection and reporting efforts of Homeless Management Information System, lead agencies, and COC program recipients. The manual provides information on HMIS program setup and data collection guidance specific to the COC program and the legacy programs, supportive housing, shelter plus care, single room occupancy for the homeless that have not yet been renewed under the COC program. The guidance provided in this document aligns with requirements around HMIS as stated in the COC program interim rule and the Emergency Solutions Grant Program interim rule, and refers to the data element required in an HMIS as established in the 2014 HMIS data standards. The document is not intended to replace the HMIS data dictionary or the data manual, but to complement them and relate COC program specific requirements. The document is not a replacement for any specific program guidance, requirements, regulations, notices, and training programs on the COC program. It only addresses the use of HMIS for COC program funded projects. It's important to be sure that communities understand the difference between a program and a project because they have distinct meanings in this context. A program is the source of funding that the organization is receiving to run its project. Example, COC program funding for ABC Transitional Housing Project. For data collection purposes, HUD and its federal partners refer to categories of funding within a program as components. For a COC, there are 5 program components that communities can establish and operate projects under: permanent housing, transitional housing, and supportive services only, HMIS, and in some cases, homeless prevention. Additionally, there are safe haven projects with previous funding under the supportive housing program that will be renewed under the COC program and legacy programs. Supportive housing program, shelter plus care, and single room occupancy for the homeless have not yet been renewed under the COC program. The project is a group of activities on the ground delivering services or housing for the homeless client. So identify projects for inclusion in HMIS. Identify all of the projects within HMIS implementation that receive COC program funding or are still receiving their original funding through HUD legacy programs. Identify funding components for each project. Identify the component for the project funded through the COC program via the project's grant agreement. The COC program includes 6 eligible components. Permanent housing, which has 2 distinct types. Permanent supportive housing provides indefinite housing assistance in community-based housing paired with supportive services to assist homeless individuals with a disability or families with an adult or child with a disability achieve housing stability. And the other component is rapid rehousing, provide short or medium-term tenant-based rental assistance in community-based housing paired with necessary supportive services for homeless individuals and families with or without a disability. Supportive services only component of the COC program provides services to homeless individuals and families not residing in housing operated by the recipient. Funds may be used to conduct outreach to sheltered and unsheltered homeless people and families, link clients with housing or other necessary services, and provide ongoing support. The transitional housing component of the COC program provides housing and accompanying supportive services to homeless families and families for up to 24 months to assist with stability and support to successfully move and to maintain permanent housing. The homeless prevention component is limited to recipients in high-performing communities only. The HMIS component of the COC program may be used only by HMIS lead agencies for costs associated with HMIS. No HMIS project setup is required for grants funded under the HMIS component. Safe Haven program is a component that can be renewed from the SHIP program under the COC program. All Safe Haven projects can be renewed to continue ongoing eligible costs and must be included in HMIS. For projects new to HMIS, the system administrator will need to follow the normal setup procedures required for the community HMIS. All projects with existing HMIS records should be checked for accuracy and consistency with the HMIS data standards. This must include the following project descriptor data elements: the organizational identifier, the project identifier, the project type. Enter a grant identifier for each COC program grant the project receives, along with grants operating start and end dates, a bed and unit inventory information, site information, and the target population. All COC program funded projects are required to collect all of the universal data elements and a select number of program-specific data elements, which are mentioned right here: housing status, income and sources, non-cash benefits, health insurance, physical disability, developmental disability, chronic health condition, HIV/AIDS, mental health problem, substance abuse. There are several data collection issues that apply to COC program funding projects for which both system administrators and HMIS users should be aware of. Homeless prevention and rapid rehousing are two separate projects in HMIS. They are not combined into one project. In addition to universal data element, homeless prevention projects must also collect housing assessment at exit information to more accurately reflect the housing situation of clients. And data collection must include an annual assessment for all people in the project for 1 year or more. Data collection must include an annual assessment for all people in the project for 1 year or more for permanent supportive housing as well. Rapid rehousing usually begins prior to the client entering housing. Depending on the HMIS setup, data collection may occur in one of two ways. First method is identifying residential move-in date, and the second method is using a pre-entry project, using a project type of service only. Supportive services only projects are often the most complicated to set up and manage in HMIS. Consideration of the COC's privacy and security policies for HMIS will often determine how the project is set up. Pay careful attention to the project typing instructions. Data collection must include an annual assessment for all people in the project for 1 year or more. For street outreach, a street outreach project is likely to encounter difficulty engaging homeless people. Street outreach projects may record a project entry with limited information about the client and improve on accuracy and completeness of client data over time by editing data in an HMIS as they engage the client. Initial entry may be as basic as the project entry date, a made-up name, that is Red Hat 10th Street Bridge, that would be identifiable for retrieval by the worker in the system, and gender. Over time, the data must be edited for accuracy, replacing the made-up name with the correct name as the worker learns that detail. A street outreach project is expected to record every contact made with each client in the HMIS. Contact is defined as an interaction between a worker and client designed to engage the client. Contacts include activities such as a conversation between the street outreach worker and the client about the client's well-being or needs, an office visit to discuss their housing plan, or a referral to another community service. Contact must be recorded anytime a client meets, including when an engagement date or project entry date is recorded on the same day. An engagement date is the date when an interactive client relationship results in a deliberate client assessment or beginning of a case plan. The date of engagement should be entered into HMIS as the point when the client has been engaged by the outreach worker. This date may be on or after the project entry date and must be prior to project exit. If the client exists without becoming engaged, the engagement date should be left blank. If the client was contacted on the date of engagement, a contact must also be entered into that date. Data quality. According to HUD, on data quality for street outreach projects is limited to clients with a date of engagement. Therefore, it's important that when a worker records the date of engagement, he or she also reviews all the universal data elements and applicable program-specific data elements for completeness and accuracy. Data collection must include an annual assessment for all people in the project for 1 more year, and for transitional housing, data collection also must include an annual assessment for all people in the project for 1 year or more. In summary, HMIS is an important tool for metrics. It's a way to track success towards outcomes. It's a requirement for many grants, and excellent resource to identify performance measures. Like all data collection methods, the output is only as good as the information that is inputted. Agencies using HMIS should continuously review their procedures for data quality. HMIS as a data collection tool is being used for more than tracking success in eliminating homelessness. It's also a clearinghouse of many other services in the community. In essence, it's not really a homeless management information system as it is a client management information system. Thank you.